quite a thing on that. And so you also forever more than 3 embryos. And we as a clinic, we never transferred more than 2 actually of multiple pregnancies. But what I can imagine is also Switzerland compared to Eastern Europe, bigger stimulations than what we did. Sometimes it happens, they just overreact and then you get more. But I can imagine that maybe sometimes they overstimulate follicles or the electrolytes.
So you've been running the hospital for around a month now. Have you had many patients who come to you with infertility issues?
Yeah, quite a lot. I haven't counted them, but I'm sure it's been over 10.
So that's a big number for a small town like the one that you are at.
Yeah.
A new hospital.
And that we've not even advertised for infertility treatment or anything. So I think it is a pressing issue here.
The merits of doing IUI and the demerits of doing IUI.
Well, of course, mainly an IUI helps when the motility of the sperm isn't very good. So with doing the IUI, of course, after the wash, you can then, increase the concentration of motile sperm. And by doing the IUI, you can increase the chances that they will actually reach the fimbria at the time that they should, by shortening, of course, the whole way they have to travel. So especially in patients where the sperm has a reduced motility or even concentration, you can help them a lot with that. And of course, the disadvantage is you take away any sense of romance from the idea of conceiving.
Yes. Very surprisingly, I was interviewing another doctor in mainland India, and I asked her the surprising reason of infertility in India. And back came her reply, non-consummation of marriage. Yeah. Have you seen?
Really?
Yes, it really surprised me too. Have you seen cases like that?
Okay.
In where you practice also?
No, I mean, I don't even think that they wouldn't consume the marriage, but no, I think here that much of awareness is there. That's from the infertile. I mean, most of these infertile couples I've seen so far, most had already been to 2 or 3 places for treatment or for investigations at least. So I think they do have quite a good idea of what's going on.
Your patients who have come to you, what has been a common cause of infertility according to you?
Well, 2 couples, they had, the husband had azoospermia. So that's actually quite surprising because I rarely found that in Switzerland. I mean, it did occur, of course, but in all those 8 months, I came across maybe 2, 3 or 4 maybe. And now in this month, I've already seen 2. So I'm wondering also about that. And then, of course, many have had also those problems with the prolactin, that it had been high. That was one thing. And then I think most of them are a little idiopathic. You can't completely pinpoint what the reason is. And then age. Yeah. I think age is also a bit of a factor. Now people are trying to conceive later in life. And so that's also an issue. Of course, that's everywhere in the world.
Yeah, very interesting because azoospermia, no matter how many times you try, unless he gets medical intervention, he will not be able to make his wife conceive. But in India, a lot of times, it is only the wife who goes for treatment and not the husband. And I'm sure where you're practicing, it could be different, but this is a general consensus among doctors from other parts of India. One of the common thing that doctors are saying is smoking, drinking, doping, drugs of anything is also a leading cause of infertility. Do you think that also holds true for where you're practicing?
Well, not for the women. I don't think any of those women were smokers or drinkers. And the men, I honestly didn't interview them in detail about their habit. But then something is, because all the other men actually, they had normal sperm counts. But there's one hiccup here now. The WHO definition of the norm ranges in the sperm counts is anything above the morphology above 4% of normal forms is normal, yeah? And then there's also the motility has to be above 40% to be normal. Now, all the sperm analysis I'm getting here show like 80 to 90% motility and like 80 to 90% of normal morphology. So I'm thinking, are the lab analysis of these things, do these lab technicians actually know what they're doing? Because I'm wondering, how come in Switzerland I rarely found anyone with more normal forms than 10%, and here they're all getting like 80-90% of normal forms. So I'm also wondering about the lab analysis. Is it much more strict, and or what guidelines do they follow here compared to Switzerland? Although it's actually a WHO standard I'm talking about, it's not a Swiss standard we're talking about. So those things also confuse me.
There's a research paper which says that the sperm count of Indian men have fallen drastically, and it's now 20 million. Earlier it was 60 million. So that's also new research being found. What are your thoughts about the side effects of doing IVF? Because I came across a patient and she went for 5 rounds of IVF, and she said she developed lumps on her breasts as a side effect. She said it was non-cancerous, but her breasts started developing lumps by the 4th IVF cycle. And when I asked her why, she said it's because a lot of estrogen and a lot of other things are pumped into the body, and therefore that's the side effects.
Of course, high estrogen, progesterone levels, and then they stimulate the breast, no doubt. And most probably she was having fibroadenomas or some cysts or something. I don't know how they do the IVF here, actually. I have heard that they transfer more than 2 embryos. I mean, the regulations in Switzerland for IVF and for or any infertility treatment actually is really strict. Like oocyte donation so far, I don't know if they've legalized it now, but there was a vote. I'm not quite sure actually right now, but for a long time, actually, that wasn't allowed. So there's actually quite a strict thing on that. And so you also weren't allowed to transfer ever more than 3 embryos. And we, as a clinic, we never transferred more than 2, actually. Because of the risks of, multiple pregnancies. What I can imagine is also Switzerland compared to Eastern Europe, Cyprus, Turkey, wherever, there they did much bigger stimulations than what we did. We would always make sure the stimulation you wouldn't get more than, or try not to get more than 15 oocytes or follicles. Sometimes it happens, they just overreact, and then you get more. But I can imagine that maybe sometimes they overstimulate the ovaries. And of course, then they have the risk of the overstimulation syndrome, which can be quite bad. And they have to be hospitalized, and all the electrolytes go haywire, and it is quite dangerous, actually. So a person who doesn't really know what they're doing, it can get quite dangerous. If you don't judge the patient right and give them the right amount of hormones for stimulation, for the right amount of duration, and so they can get quite sick just from the stimulation alone. And then, of course, it's mentally extremely stressful. I think that's a big side effect of IVF. It's a lot of money, and then you're on needles already. You don't want it to go wrong. The more stressed you are, the more unlikely it will work. I think mentally, and then if it doesn't work out after all that, ordeal of stimulation, all the swelling in your abdomen, and then the whole, I don't know how they do the punctures here, whether they use whether they give anesthesia any kind, or whether they just do it without anesthesia, I'm not sure. Puncture time, when you take the oocyte, then the wait for the transfer, and then the wait to see the 2 weeks if it's conceived or not, and then if they've even fertilized the eggs. I think all those factors are extremely stressful on anyone.
Dr. Nadia, we have a base across in different parts of India and in other parts of the world also, and infertility now being recognized as an epidemic. What is an advice that you want to give to our listeners?
First of all, don't wait too long to try and conceive. Don't, especially as a woman, try and have your first child before 35. Start at 30 if possible, if you're studying. I think that's, yeah, if you find the right partner, of course, better even in your 20s. But I think now for us women, it's very difficult to balance, a profession, achieving something, you've been sent to school for so many years and then you're sent to college and what? Should have gone cook and sit at home with babies? Is that the idea? So I think that kind of a balance has to come more, that you can actually have a child, still study, still, follow a profession, have that family support for that. And I think not waiting too long is my biggest advice. And then
thank you so much for your time. And we wish Unravel Hospital the very best from Subhak Health Tech. May God give you more wisdom and guide you, and we'll always uphold each other in prayers.
Yeah, okay. Yeah, thank you. Okay.
Bye, Dr. Nadia.
Yeah, bye-bye.